150 research papers and 2 oral cancer textbooks, and is an internationally recognised authority in oncology. I'd like to ask you to all join me in giving a very warm welcome to Professor Peter Thomson.
I'm Peter Thomson. I'm Professor of Oral and Maxillofacial Sciences and Head of the Academic Department of Dentistry at James Cook University, located in Cairns, far north Queensland. I started my career many years ago wanting to be a dentist, and I think the ability to offer some expertise, some specialist help, and to try to improve people's health and life was my motivation. As I underwent my training, I developed a particular interest in surgery, head and neck anatomy, pathology, and so ultimately I trained as an oral and maxillofacial surgeon in the UK. My particular research interest developed over 45 years ago when I first came across, as a dental student, a patient who developed mouth cancer. And this seemed a tragedy to me because this patient had spent many years attending the specialist oral medicine clinic of our dental hospital for care. But despite that, she had still gone on to develop a life-threatening cancer of the oral cavity. My research and my work through my career has been to try to understand the oral carcinogenesis process, how to intervene, how to reverse that process, and try to save life. For me, the lack of progress was recently demonstrated by a general press item of a patient who had been looked after by her dental specialists for 18 years, but despite that treatment went on to develop a life-threatening oral cancer. That was my observation as a student 45 years previously, and so it concerns me that we still haven't been able to move many of the improved scientific understandings of the process of cancer development into the clinic, into highlighting those populations in our community, those individual patients in our populations, and their oral mucosal lesions that are at high risk of cancer development. What we discussed today was much of the work that my colleagues and I have done over the years to recommend an interventional strategy whereby identifiable precursor lesions, potentially malignant disease, is recognized, treated. The treatment we recommend is interventional CO2 laser excision of these lesions, and discussing how that can really not only prevent cancer development, but help in the longer term follow-up of these patients to look for signs of further disease or indeed second primary tumours, which is a significant cause of mortality for head and neck cancer patients. We highlight in a simple mnemonic oral cancer a range of clinical presentations that not just oral healthcare practitioners should be aware of, but all healthcare practitioners, in particular primary care physicians, pharmacists, to recognize that a persistent oral ulceration, red and white patches, abnormal swellings, loss of tongue mobility, changes in the appearance of the mucosa, and unusual signs and symptoms that don't quite fit together should raise alarm bells and identify people and specific mucosal disorders that warrant immediate referral intervention. Because we know that early diagnosis, minimal intervention can be curative, and of course can be curative and reduce not just mortality, but actually reduce morbidity. Oral cancer is, as far as oral health and dentistry, our most lethal and dangerous enemy.